Dr. Joe Congini with us, Akron Children's Hospital in studio. Super Bowl week behind us. You wanted to talk a little bit about Patrick Mahomes and the recovery he had.
Yeah, let's look back in time, and maybe we can entitle this entire football season from a sports medicine perspective, what a difference a ligament makes.
Yeah.
Is which ligament is it? So I saw an interview midweek with Mahomes, and he talked about when he twisted, felt a pop, swelling and intense pain in his knee, and as the trainers and medical team came to him, helped him off the field, got him onto the cart to cart him off, he was thinking about season was over, starting to think about next season and all the pain of that kind of thing. And as we know now, it turns out the ligament that he tore was the medial patellofemoral ligament. Big name, fancy name. Nobody hears of that like the ACL, the anterior cruciate ligament, but very common. In our office, very, very common. We see a lot of kids with patellar dislocation. So let's look at the other side of patellar dislocation. Fortunately, this ligament on the side of the kneecap that holds the kneecap in place, it will heal. So for a lot of our young athletes, if they just follow the prescription of Patrick Mahomes, he gave it 4 weeks to heal where he rested. He rehabbed like crazy. 5 weeks, 6 weeks, he came back very strong. So strong, obviously, he was dynamite down the stretch of the season. And people can do very well with what looks at first to be a very significant injury. So just think of how this NFL season turns out if that was another ligament in his knee.
Yeah, maybe we would have seen New England in the Super Bowl, or Coach Vrabel and his Titans.
Might have been Coach Vrabel, too, the way they were coming down the stretch. So it is, and it's always a matter of kind of knowing the difference. With the ACL, it just doesn't heal. We have to put a new ligament in. We know people are out for 9 to 12 months. There is some new research going on. I just came back, from Arizona at that conference. They were looking at they're using now a lot of the tendon below the kneecap to make a new ACL. But the point is, when you get a patellar dislocation, we brace kids, we rehab kids, and the outcome, Ray, is really pretty good for people with kneecap dislocation or the kneecap popping out of place. Patellar dislocation, the Patrick Mahomes injury.
Football injuries, certainly all over the place. All these teams battle through it. And that brings the point, the NFL's considering, what, a 17-week schedule?
Yeah, as we're looking in the offseason, we've been hearing 18 and doing away with 2 exhibition games. Now, gosh, 17 games. I know how much people love their NFL and love football, but gosh, it's already such a game of attrition. I mentioned it last week, and some people that listened on your show really took to this, is that even concussion, but in most of these injuries, there's a cumulative effect. So you get hurt again the next week, and then you're on, the DL with a more significant injury. And 17 weeks is really too many already. It's a little bit hard to manage minutes in the NFL, but 16 games is a lot of games. Adding a 17th game, I don't think has any wisdom from a sports medicine standpoint. And same thing in our other professional sports. And we're actually moving that way in college sports, too, is where we're playing more college football games. And I really think that we should stick with 16 and avoid those cumulative effects, those injuries that kind of build on each other.
Good stuff. Joe, thanks for coming in. Great stuff this morning.
Thanks, Ray.
There you go. Dr. Joe Congini, Akron Children's Hospital